Mental health has historically been misunderstood and was originally thought to be caused by evil spirits or lunar cycles. Even ancient Greek and Roman scholars believed that lunar phases were related to mental health issues, hence the derogatory terms given to psychiatric hospitals as lunatic asylums. Originally built in 1247, London's Royal Bethlehem Hospital, rebuilt in 1676, was the first and most opulent mental asylum the world had ever seen, from the outside at least. However, Bethlehem was more commonly known by its nickname Bedlam because of the chaos that was often seen there and the appalling treatment for inmates. From 1670, mental health facilities or madhouses were in existence, but it was not until a century later that there was any attempt to inspect and regulate them. Those displaying symptoms of madness were locked away from society and very often left to die in squalid, inhumane conditions. Husbands who could afford to pay a sympathetic doctor could have their wives imprisoned at the madhouse, with no just cause other than they would not obey their spouse. It wasn't until the 18th century that the science of psychiatry really began to develop. The 1774 Lunacy Act saw the beginning of regulation, with medical certificates from 2 separate doctors being required before a person could be committed. In addition, madhouses had to be registered and annually inspected. Following an assassination attempt on George III in 1800, the Criminal Lunacy Act was passed, followed 8 years later by the County Asylum Act, which saw the building of new institutions specifically for the criminally insane. At the turn of the 19th century, insanity came to the fore, with George III's illness widely reported, as he suffered bouts of insanity until his death in 1820. The 1834 Poor Law Act were responsible for the way patients were treated during the Victorian era. It was no longer acceptable to keep poor, mentally ill people in workhouses and prisons. More orphanages were built, more hospitals were built, and for those with mental illness or learning disabilities, more asylums were built. In 1845, the Lunacy Act saw the government appoint lawyers and doctors to oversee conditions in asylums, with a focus on determining who could be certified as insane, how individuals were restrained, and how suicide could be prevented. This was followed by the updated Lunacy Act in 1890 to increase control on certification of insanity and form the basis of the mental health law in England and Wales from 1890 until 1959. It placed an obligation on local authorities to maintain institutions for the mentally ill. Many people feared the asylums, as they knew they probably wouldn't be released. Victorian women could be placed in institutions due to conditions which doctors often labelled hysteria. These included menstruation-related anger, pregnancy-related sadness, postpartum depression symptoms, disobedience, chronic fatigue syndrome, and anxiety. Women had few or no rights, and disobedience was often met with severe punishment. At the turn of the 20th century, Victorian asylums were still using controversial treatments without knowledge of how they worked. Electroconvulsive therapy, ECT, and lobotomies were routinely carried out. Some individuals were helped by these, but others were severely harmed. The 1913 Mental Deficiency Act replaced the 1886 Idiots Act, which differentiated those who were suffering from mental illness such as schizophrenia and those who were mentally disabled or had learning difficulties. This enabled the building of idiot asylums or mental deficiency colonies. Around the 1930s, changes started to occur and social policies were put into place. In 1948, the implementation of the NHS was a turning point for health in general. During the 1950s, advances in psychiatry meant that antipsychotic medication became available to help people stay in their community rather than routinely being institutionalized. However, there were over 150,000 people in hospital due to mental health conditions, and there was still ignorance about mental health, meaning that there was extreme stigma and fear surrounding it. Some individuals were still considered lunatics and defective by many, and were still sent off to asylums. The 1959 Mental Health Act was the first of its kind. It granted human rights for individuals with mental health conditions. The Act stated that people who were morally defective due to unusual behaviour would be best treated in the community rather than an institution. By 1961, it was determined that the amount of people who were in hospital due to mental health conditions should be halved. The 1962 hospital plan laid out how this was to be achieved, by stating that acute inpatient care units in hospitals should be developed and local authorities should be responsible for providing a range of services for community support. It also became apparent that individuals in asylums were subject to serious ill treatment, which emphasised the need to close them. During the 1970s, financial pressure on the government meant that community care services were not developed, and major closure of asylums didn't happen until the 1980s. In 1974, there were still 100,000 people living in asylums, which was 50,000 less than 20 years previously. Mostly older people who had been there for most of their lives, experiencing both mental and physical health conditions. The 1983 Mental Health Act was developed in response to issues that were raised under the 1959 Mental Health Act, which was still official legislation at this point. It provided rules and guidance about the treatment of individuals with mental health conditions and how the law protects them. The Act also set out when an individual can be admitted, treated, and detained in hospital against their wishes. This could only be done if an individual is at risk of harming themselves or others, and then they could be sectioned, and 3 people must agree, such as a mental health professional or close relative, a psychiatrist, and a GP. Guidance also has to be given regarding treatments available on discharge. The mid and late 1980s brought about the closure of asylums, and many people who had been in such an institution for much of their life were told now that they would be cared for in their community. However, some were still treated as inpatients in smaller mental health units in general hospitals. The 1990 NHS and Community Care Act was brought forward due to the number of people now deemed to be cared for by the community, as it was clear that services within the community were inadequate. It dictated that local health authorities had to make suitable arrangements for individuals experiencing mental health conditions and was given a duty to assess an individual's unique needs and circumstances and have an assessment and review process in place. There was hope this would be successful, but this was not always the case, and failings were highlighted by the Clunis inquiry, which took place after Christopher Clunis, who had paranoid schizophrenia and was in the care of the community, stabbed Zito 3 times in the face at Finsbury Park Station in London in December 1992. Many agencies were found to blame for allowing this to happen, and it was highlighted that agencies must work together. In 1999, the Green Paper Modernising Mental Health Services Safe, Sound and Supportive was published. This aimed to set out how the government would improve services for individuals with mental health conditions. Again, there was emphasis on community and collaborative care, laying the foundation for development fully in the early 21st century. In the 21st century, the trend towards community care remains central in mental health service provision, with 90% of those who experience a mental health condition being cared for under primary care. And the Health and Social Care Act of 2012 made it a requirement for the NHS to place mental health on a par with physical health. The Care Act 2014 makes it now a legal requirement that all local authorities have a safeguarding board in place to ensure that all safeguarding requirements by the local authority are adhered to. In 2016, the 5-year Forward View for Mental Health was published, making a series of recommendations for the NHS and government to improve outcomes in mental health by 2020-2021, including ending the practice of sending people out of their local area for inpatient care and increasing access to talking therapies. Published in 2019, the NHS long-term plan provided a number of further commitments to improve mental health services. On adult mental health services, the plan committed to providing an additional 380,000 people per year with access to adult psychological therapies by 2023-2024. Recent government initiatives have tried to ensure that mental health awareness is a key aspect of overall healthcare. Mental health has been transformed over the centuries, and there have been so many changes over the last 100 years. The closure of the old asylums, moving care into the community, and the increasing use of talking therapies. They have all had a major positive impact on patients and mental health care, But there is one real change, which has been the shift in society's attitudes. People are becoming more accepting of mental health problems and more supportive of those with issues. Common mental disorders such as depression and anxiety are now discussed more, and individuals are more ready to seek treatment.